We are really pleased to be co-sponsoring this event, which was put together by Drs. Lin and Palaniappan, who co-direct the Center for Asian Health Research and Education.
An inspiration to me, so thank you, Dr. Misra. And I especially want to thank him because it's midnight in India right now. So thank you for being up in the middle of the night to share your wisdom with us. So with that, I'm going to turn it over to Dr. Misra.
Good morning. This is around 12 midnight in India. Thanks, Lata, for inviting me for this wonderful symposium. What I'll do is I'll give an overview of situation in India, as well as will emphasize on certain research points. India has shown a slow increase in COVID-19 cases initially, but recent surge. Overall mortality remains at around 3.2 to 3.4, which is less than other nations. There are clear positives from the last 3 months. Clear directives from Government of India regarding testing, quarantine, admission. All testing facilities are under central control of Indian Council of Medical Research, and data of all patients are available. There is a wonderful app which is available, given on the right side, which if you can download on your smartphone will give you any presence of any COVID positive patient nearby 500 meters, 1 kilometer, up to 5 kilometers. There are 100 million users on 10th May of this particular app. India is a heterogeneous country. There are some states which have done better, like Kerala, on the right side if you see. Yeah. There is some other positives like improved atmospheric pollution and possibly good effect on certain diseases. That's a research point. India has ample supply of hydroxychloroquine, azithromycin, and good capacity for vaccine research. Next slide, please. There are certain negative points. There has been break in social distancing, religious places, especially migrants. You can see migrants are going back to their villages on the right side after the lockdown, and this is an editorial on migrants. Poor state of public health facilities, especially in the small towns. There's low number of RT-PCR testing. Government facilities have been overwhelmed. Private testing is costly. There's also poor attention to other prevalent infections like tuberculosis, and they estimated that around 48,000 deaths per month after the lockdown because of poor attention to tuberculosis program. And there are other programs which may also suffer, like malaria, vaccination, HIV, and these need to be researched further. Next slide, please. Now, many times people debate why India has milder disease course, less number of cases than other countries and other races. A number of factors have been debated, none have been proved. Host factors like genetic, ACE polymorphism, HLA polymorphism, immune memory like cross-reactivity with other identified coronavirus infections, influenza, etc., muted cytokine storm, effect of repeated exposure to malaria, all these have been thought of. But most debated is temperature. Besides effect of temperature on the virus, it has been seen that in cold season, it is a pro-inflammatory state. And you can see the interleukin-6 and CRP levels going down in the summers. In India, most of the states are having a hot temperature, and what that might have on the inflammatory profile, one doesn't know. That needs to be researched. Similarly, BCG vaccination, India has a universal BCG vaccination policy, and here you can see one paper, those countries who have a universal BCG vaccination policy may have lesser COVID-19 mortality. Next slide, please. Now, this is a topic close to my heart. Numerous questions about diabetes, COVID-19, and lockdown. I have put a number of questions. Most of them are being researched at this point. Role of diet and supplements in increasing immunity, and effect of anti-hyperglycemic drugs on COVID-19 disease course. Effect of COVID-19 on beta cell dysfunction or insulin resistant. Many Indians are insulin resistant, and then they have diabetes. So that is important for India. Effect of COVID-19 on diabetes related complication, and effect of lockdown on glycemia, future glycemia and diabetes related complication. That has been published by us, that there will be a great increase in the glycemia subsequent and also increase in microvascular and macrovascular complication. Next slide. Next slide, yeah. This is my last slide. This shows the research capacity and preparedness in India, some bad points and some good points. Good points are laboratory and virus research. There is a good capacity and could be enhanced. You can see about 100 laboratories which have capacity to track virus, to test virus, and also 25 laboratories can research virus. They are under Indian Council of Medical Research. Here, it's a top, on the top is ICMR and National Institute of Virology, Pune, and under them are a number of other laboratories. Clinical research is poorly coordinated. Drug research, there is some capacity and there are trials underway for hydroxychloroquine and remdesivir. Work ongoing on the vaccine, and this is the most exciting area as far as India is concerned, because we have good research capacity as far as the vaccine is concerned and also manufacturing. Our workforce as far as the basic medical and technology based disciplines is poor, and that may be impacting overall preparedness for this epidemic. And finally, the manufacturing capacity for PPE and mask has been enhanced to now 200,000 per day. And so India is self-sufficient as far as the PPE and mask manufacturing and other simpler things which are protective for like the sanitizers, etc. That has been, the capacity for manufacturing that has been enhanced. Thank you.